I'm Justin, and I'm with Core Physical Therapy, and I've got my patient here, Mike, who is here for right shoulder pain. And what we found is through our assessment of looking at the whole person, oftentimes where the pain is isn't exactly where the problem is. And from our experience, oftentimes a shoulder problem is because some part of you in your upper middle back and your rib cage doesn't move the way it's supposed to, which then forces other things to have to work more. So in a situation of me working at 120% and somebody else working 70% in a factory, let's say, I would be the one that would be tired, achy, sore, but I'm compensating for somebody that's not doing their job. And that's what we do, is we try to find the places in your entire person to figure out what's not doing its job, so that we can allow it to help, and then the thing that's in pain or irritated can finally relax, be released, and then you can move pain-free. So one of the techniques that we do is called myofascial release, and in this specific technique, we're going to look and see how well does Mike rotate his whole body to the right, because if he doesn't rotate to the right, his right arm can't go up and out to the side. So it might be a tennis player, it might be somebody just reaching up to put a dish away. It might be any repetitive painter, or anybody that uses their hands up above their head. So what I'm going to have Mike do is I'm going to take his arm and we're going to grab onto his shoulder blade, because the shoulder blade is home base for your rotator cuff. A lot of people hear of rotator cuff tendonitis, or that's sometimes just a blanket statement for shoulder pain. Now, Mike is going to be totally relaxed, and I'm just going to rotate him here, and now he starts to get tight right about here. Now he's not in any pain because I'm totally relaxing him, but his body stops here. Now what I'm going to have him do is I'm going to say, Mike, take a deep breath in for me. And then as he breathes in, that increases the tightness. And then as he blows out, and now his body just naturally rotates a little bit further. And so what we're doing is, in a pain-free way, we're using his body to help fix his body's problem, which then that helps to translate into the carryover of him feeling good when he's out of our clinic. So go ahead and do it one more time. So deep breath in, hold it, hold it, hold it, and blow it out. And you can see how he rotates really, really well. So just by doing that, now we've already gained 25% better rotation in his trunk than we would expect his arm to move better as well after that. His home program then would be designed to help his body remember how to turn to the right. So we would do some twisting and breathing, which are things that we don't really do in life and are super, super important for just overall health. So that's just one of the many things we do here at Core Physical Therapy.